Welcome everyone to this webinar, How Far Should We Trust AI in a Crisis Situation? The work we're looking at today is focused on two outputs from the European Scientific Advice Mechanism to the European Commission. The first one is a rapid evidence review report from SAPEA, and the other is a statement by the group of chief scientific advisors. Both of these came out in December, and they're the focus of today's webinar. You can see on the right-hand side the URL for accessing these reports. I'm Louise Edwards. Today's webinar is going to be 1 hour. You can see here the times in Central European Time. In a moment, we'll hear a few words of welcome from Alea and Cardiff University. We'll then move on to some background and context. The main part of the webinar will be the panelists' presentations, which will be 5 minutes each. And we aim to finish at around 40 minutes to the hour to give enough time for discussion and for Q&A. And we'll wrap up and close on the hour. So the chat box is open and you're very welcome to use that for general discussion. But if you'd like to communicate with the panelists and put questions or comments, and you're very welcome to do so, then please use the Q&A box. We'll be monitoring the Q&A box rather than the chat box. So at this point, I'd like to hand over to Marie-Louise Noche, who's Vice President of Alea, and Professor Ole Petersen at Cardiff University. Marie-Louise, over to you.
Thank you very much, Louise, and thank you to the participants and the speakers, and welcome to this webinar. It was born out of the work done in the statement of the group of chief scientific advisors of the Science Advice Mechanism, and in the rapid evidence review that you've just seen on the screen, on the topic of AI in emergency and crisis management. So I would like to thank you all for your great contribution, the speakers and the experts today. Just a few words about Alea, since Alea has had the leading role in this program. Alea is the representative of all European academies. It's the abbreviation. We have 60 member academies in 40 countries, and therefore represent academies beyond the European Union. And we also represent the young academies in Europe. And we have a role in the Science Advice Mechanism in that we are part of SAPEA, and there act on the request of the Commission to help giving advice. As Vice President of Alea, I would just say briefly thank you to you all, and welcome distinguished speakers, experts in the audience. I hope we'll have a very open and interesting discussion that there is time for. You can see that it's a truly European group with distinguished experts, and we have here both the chair and a member of the HARD working group, and a contributor to the working group, 2 chief scientific advisors, and also an expert practitioner. So I think we will have a really relevant and very different perspectives on the topic of how far should we trust AI in a crisis situation. So with this, I hand over the word to Ole.
Well, thank you very much, Marie. On behalf of Cardiff University, it is my great pleasure also to welcome you to this webinar on AI in crisis situation. Now, you may wonder why Cardiff University, which obviously is not an academy, is a partner in SAPEA, which of course means Science Advice for Policy by European Academies. This came about via Academia Europaea, one of the founding partners of SAPEA, and the only Europe-wide academy electing individual members simply on the basis of academic excellence. At the time when SAPER was founded around 2016, I was Vice President of Academia Europaea, and I oversaw, together with Louise Edwards and Karina Keskitalo, the very first evidence review report produced by SAPER on food from the ocean, which became a model for how these things should be done. At that time, there was an Academia Europaea Knowledge Hub at Cardiff University, and the then president of Academia Europaea, Serd Klöting, decided that we were supposed to provide the Academy's input to the SAPER mechanism. And this continues today. Now Cardiff University is formally an independent partner in the SAPER process through a grant directly to Cardiff University, for which I am the PI, that funds Cardiff University's input to the mechanism. Cardiff University has a specialist unit for review evidence, which actually celebrated its 25th anniversary last year. And this means that we are increasingly particularly concerned with literature reviews for now every single project that SAPER undertakes. So with these few words of explanation for how Cardiff University became part of a European Academy network, I'm very happy to wish you all a great webinar. The program looks really exciting, and I'm handing you over now to Louise Edwards.
So thank you both. Let's meet our panelists. We have Professor Tina Comes, who recently moved to the German Aerospace Center, where she is a scientific co-director. She was the chair of the SAPER working group on this particular project. Professor André Zweiter has also recently moved to Austria, to the University of Klagenfurt. And he worked alongside Tina on the evidence review report. Assistant Professor Olja Kudina is Assistant Professor in Ethics and Philosophy of Technology at Delft. She was a contributor to the report. And then we welcome Captain Quentin Bro, who is Head of Innovation at the French National Training School for the Fire Service in France, and should give us an interesting perspective from a practitioner angle. And then last but certainly not least, Professor Remy Slama and Professor Rafael Lukasis, who are members of the European Group of Chief Scientific Advisors and worked on the statement that you saw earlier. So welcome to you all. We will start with a very short presentation from Geoffroy Delamere and Sarah Saba of SAPER on the background and context to this work, why it was done and what the process was. So over to you both. Thank you.
Thank you, Louise, and good afternoon, everyone. So my name is Geoffroy Delamare. I'm a policy officer at the European Commission, and I'm working in the SAM Secretariat, so working for the Scientific Advice Mechanism. The SAM is composed of three parts. There is SAPER, which is a consortium of academic networks, which ALEA is part from, as you just heard in the previous presentation. But it is also composed of the group of chief scientific advisors that issue scientific recommendation to the College of Commissioners. And the last part of the SAM is the SAM Secretariat, which is a unit that sits in the Directorate General for Research and Innovation here at the European Commission. And we really work on the coordination of the whole mechanism. Next slide, please. So as you can see here, the SAM really sits at the interface between science and policy. And the role is really to bring scientific evidence directly into policy making. Next slide, please. And the group of chief scientific advisors is composed of 7 members that have been appointed by the commissioner for startup research and innovation. And you can see the full list here, and it is represented by Rafael and Remy today. And next slide, please. About the SAM Secretariat, which I'm part of. So we are a small team within the European Commission, and we really act as a liaison between the SAM and the European Commission. We coordinate the scoping paper development. We support the advisors, and we also do the coordination with SAPEA to communicate the request from the European Commission to SAPEA, to the network, and to coordinate with the advisors the scientific opinion. And importantly, we also analyze the policy landscape, and this is to make sure that the scientific evidence are really brought directly into the right policy context that is happening at the European Commission. And about the request about AI in disaster risk management. So we received this request, which was a bit unusual. It goes a bit, it's not usually the way we work, but we received a request for a rapid evidence review reports to understand what could be the role or actually the opportunities and risks associated with the use of artificial intelligence in disaster risk management and how this risk can be mitigated. It was initially a request to SAPEA, and we're very lucky that Professor Tina Combs was available and interested to work on this topic. And SAPEA produced a report on this topic. And at the time of the request, we also didn't have a working group of scientific advisors, so they were not really involved at the beginning. But once this initial report by SAPEA was produced, the group of chief scientific advisors was very interested in the topics, and they had very strong opinions. So they produced a very good statement that was published a little bit later on AI in emergency and crisis management. And actually, both documents were actually very, very well received by DG ECHO in the European Commission that were at the origin of the request. So yeah, again, thank you everyone for joining, and I will hand over to my colleague from SAPEA for the rest of the presentation now.
Thank you. Quickly now about SAPEA. You've heard this acronym several times now. It stands for Scientific Advice for Policy by European Academies. And SAPEA is a consortium of 6 academy networks, which you see represented and listed in the figure here on the slide. SAPEA brings together around 120 academies from across Europe, which means also that it offers wide and excellent expertise across several research fields. SAPEA provides independent evidence reviews on request, and it also informs, of course, the advisor's policy recommendations. Next slide, please. It's the last slide we have, and it brings together the background that Geoffroy and I have given you now. So sort of summarizes the 4 essential moments of how we work. So we receive a request by European commissioners for advice on very different scientific topics. Then SAPEA forms working groups who then summarize, analyze the existing evidence and write evidence review reports. And the advisors write a scientific opinion which relies on the evidence. And then at the end of this process, we deliver both recommendations and advice to the Commission. Now that, we've said who we are, how we work, I would like to invite our first speakers, Professor Tina Combs, to start her presentation.
Thank you, and thanks for the introductions. But it's also great to see that so many people from each side of the pond are joining. And if we were in a room, we would be a very full room. So I'm really great that you're all here. I will start with an overview of the rapid evidence review that we did. So our starting point was, of course, this is a review that we did for ECHO, for Europe. And one of our starting points that's distinctly different from national approaches is that crises are increasingly European, meaning they're crossing borders. And that means that there are specific challenges with respect to data sharing, data standards, but also the comparability of the different approaches. And we took that distinct European lens on AI as one of our starting points. Next slide. At the same time, we also, of course, realize and understand that we live through a great transformation. We live in what I called here an era of AI, with a challenge that there is no single one AI. You can see, for instance, on the left side, the tool that now most people probably associate with AI, ChatGPT, which is increasingly used in different kinds of settings, including, you see here, a cheat sheet for crisis management, as well as specialized applications, for instance, the Google Flood Hubs for flood monitoring and prediction. And with this working group, we really tried to understand what the different lenses, tools, and algorithms are and how they contribute or can contribute to crisis management. Next slide. And that's also one of the backgrounds of this research. So with respect to some technical performance benchmarks, we see that AI is increasingly is performing better and better, and in a couple of standardized tasks already better than the human performance. So of course there's a question of how and in how far do we want to leverage this algorithm specifically for the area of crisis management in Europe. Next slide. And that's the question we received then. You've already seen that on the slide. What are the characteristics, opportunities, and risks of AI in crisis preparedness and response, and how can these risks be mitigated? What we then did, next slide, is we really looked at, so you can imagine that's a gargantuan question. We tried to have a dedicated, human-centered lens on this, really using as a starting point that AI needs to support the human crisis response. And then we ran through the process that Sarah and Geoffroy have already described, with a really dedicated working groups in sort of a pressure cooker setting. And a big thank you to all of those who worked with us on this project and made that possible in very short time. So here you see the names, but also to the SAPEA Cardiff teams. It's been really a great pleasure to work with you. Some of the principles we followed is what I already mentioned. AI is very diverse, and it's not just ChatGPT. At the same time, we also acknowledge how rapidly the field is developing. And that means that rather than describing a certain algorithm or tool like it is now, we focused more on the principles rather than saying this tool right now is good or not good, or suitable or not suitable. And then the final aspect, of course, that AI has to support the work of the people that are using it. AI has to serve us and should not become an objective in and of itself. Next. And I will hurry now. Having said that about AI, it's of course clear that AI is and will be applied in very diverse fields across different phases of the crisis management cycle, but also has really different applications from very local contexts, more at asset level, towards global applications. And really starting the discussion about AI and also trust in AI really has to start from these different contexts. Next. We also looked then, of course, on sort of the general ideas on when can we apply AI, which always relies on data, and when do we want to rely on AI. And we say that, of course, you heard already that the context matters, but also that we have to think about when do we want to give the responsibility for a decision to an algorithm, and what checks and balances need to be in place. And then, of course, we also say that introducing tools should not replace the idea of human connections and empathy that are especially important in eras of crisis. Next. And this is then the topic of this webinar today, the use of AI. So when we started working on this report, we heard a lot in the discussions from practice at conferences. How do we make people trust AI? Meaning, how do we make people use it? So this idea that it would be this huge potential, and you only have to make people trust it to to be able to unlock that potential. But at the same time, we also stress in the report that there are these huge risks of over-trusting and over-relying on AI if we use them like an autopilot, and that we will blindly accept something that an AI is stating, especially if it sounds very credible and plausible, or if we're under a lot of stress. And we say that this is a Goldilocks dilemma, and I'm really looking forward to discussing this in this webinar. Now I will close. Next slide. So when it comes to the questions and the overall reports, you also saw, of course, the links in the slide. We focus on data preparedness across borders, training, data literacy and standards, strategic autonomy for critical systems, of which AI and digital systems are some, and then this human-centered implementation. Thanks so much. I try to keep it very short. Now over to the next speaker. Thank you.
Thank you, Tina. Moving on to Professor André Zweiter, who is at the University of Klagenfurt and also worked with Tina on the expert working group. André.
Well, thank you so much for having me here. Thank you, Tina, for the wonderful introduction. In essence, we faced a similar challenge than the EU faced when trying to regulate artificial intelligence. And Professor Combs has already mentioned it. The breadth and the different applications that AI is capable of makes it rather difficult to assess with utmost certainty what the legal requirements and the ethical requirements are. Nevertheless, that gave us also the opportunity to give a high-level perspective on the situation. And we looked for our report, therefore, specifically at the EU AI Act and how it applies to crisis management specifically. But we also looked at ethical guidelines in how they help us understand the use and capabilities of AI and the humanitarian aspects that we need to consider in order to apply it. Now, when we come to the EU AI Act, we find that the EU AI Act, for one, is focusing on what we would call a risk-based approach. That means it classifies AI into different risk levels. We start with minimum risk, such as AI in spam filters, with a limited risk, such as in chatbots. But then we have a very large area that is called high-risk AI systems, where also possibly many of the AI tools will find themselves that apply to crisis management, but not necessarily. And then we have a large category of unacceptable risk, where the use of AI is simply prohibited, such as in social scoring systems or manipulative use of AI. Now, when it comes to the AI Act, the first question that we need to ask in the context of crisis management is whether it concerns a military or national security purpose. So whether AI is used for military or national security. Because under these conditions, we find that Article 2, Paragraph 3 of the AI Act exempts the application of the AI Act to this use. That does not mean that for all civil protection operations, the AI Act is inapplicable. Rather, the contrary, most of the civil protection mechanisms will stay intact. Then the next step that you would have to take is to look at what sort of risk level are we addressing, and there specifically high-risk systems are of relevance because they are specifically regulated. Article 6.2 classifies high-risk systems through reference to Annex 3. And here we find specifically one aspect that seems to be rather specific to AI in crisis management. Here it is specifically mentioned that as high-risk systems should be considered AI systems intended for dispatch or to establish priority in dispatching of emergency first response services, including, say, firefighters or medical aid. So as soon as, so to speak, triage decisions would be taken, the chances are very high that we are concerned here with high-risk AI. And that requires then a heightened challenge to the deployment of AI, such as risk management systems that need to be deployed throughout the life cycle, high quality data that needs to be used, heightened technical documentation, but also other transparency requirements and explainability requirements, and specifically human oversight. Besides the high-risk components, we also find the separate category of general purpose AI. So here we are dealing with artificial intelligence that is not specifically designed for crisis management, but includes issues such as large language models. We've heard before already about ChatGPT, but also image and pattern analysis or other predictive tools could be falling under the general purpose AI component. And in those cases, we also have additional requirements that need to be met, specifically transparency, technical documentation, disclosure, and other aspects. And it could be also then that such AI models then would fall under what is termed systemic risk. And systemic risk models face even higher obligations. And systemic risks are independent of the content that they are being applied to, but rather it concerns the capability of the model itself. And we speak here of, so the regulator speaks here of 10 to the power of 25 flops, so flow point operations per second. That is the technical component. So you have to ask yourself first, is it a national security or military context? Is it a high-risk tool? Does it use a general purpose AI? And then is it systemic? Is a systemic risk involved? Besides that, we have a large spectrum of ethical guidelines, and it would go beyond the scope of this webinar to pinpoint them all out. But the topics are very parallel to what the AI Act already stipulates. Important issues are indeed human agency and oversight, the technical robustness, but also the assurance that the training data is without bias and well vetted. In other words, high quality training data. Privacy governance components also play an important role, and most importantly is indeed accountability. Both accountability vis-a-vis the regulators, but also vis-a-vis the affected people. And so we find that the soft law mechanisms that you find here on your left-hand side cover very well also what the European regulator was aiming for. And they should also always be applied in parallel and not in exclusion of each other. I think that covers the most important issue, and I'll hand over to our next colleague.
Thank you. And moving on to Olja, who is at Delft and was a contributor to the report. Olja.
Thank you so much. So in my part of the report, I was invited to take a historical perspective and to look at how the use of AI was implemented during one of the most rapid and unprecedented global emergencies, namely during the COVID-19 pandemic. So COVID-19 exposed the currently available capabilities within AI across different sectors that started to emerge in different topic-based applications, because COVID-19 introduced a lot of societal urgency, and cases of AI introduction that were available up until then had to be very quickly fitted to fit the rapidly developing situations and rapidly developing toll on healthcare workers, but also tried to be implemented in the epidemiological setting. So within my contribution, I showed 3 different reports, 3 different cases, how AI was used. One of them is contact tracing. The other one is use of AI for image analysis in chest scans to diagnose the presence of COVID-19. And the third one is for enforcing quarantine. Now, there may have been others, but these ones became some of the most prevalent ones. So contact tracing that was used usually in combination of government initiatives that were building based on corporate infrastructure by primarily Google and Apple to build localized national applications that were very often built on a combination of data tracking with Bluetooth-based signals to detect proximity of people next to each other and combine different types of models, trying to understand how people relate next to each other with space. And some of the key ethical and societal tensions that we learned of from the use of this case during the COVID was that there's a lot of uncertainty and sometimes open public discontent in terms of relying on corporate infrastructure to shape matters of very urgent and rapidly developing public policy and response. And that became a big tension when some of the dominant values that became at the sort of tension point friction, as on the one hand, the privacy of individuals and the civil liberties of people, and on the other hand, the value of solidarity of people trying to share their data and being willing to share their data for the health of preserving public health, but at the same time feeling the tension that those applications are used precisely in corporate infrastructure. And there was not always well-communicated public strategies on assuring the publics as to how the data was used, how it was being processed, what was shared with the corporations, whatnot. So there was a lot of uncertainty that people started to fill in on the go. Some of the risks that related to it were related to identification of data of citizens, especially in governments that had a more centralized manner of processing the data rather than the decentralized manner. And there was a lot what we learned about how people took up the use of these apps in practice. So sometimes technological capabilities were quite well developed and technologies were ready to be deployed, but they simply didn't take up in practice. And that didn't depend actually on technological readiness, but it depended on a whole range of socio-technical factors, namely, for instance, again, the lack of clear communication policies on behalf of the government or the conflicting messages that the publics were repeating, but also some descriptive observations that people were seeing from how these apps were used. For instance, sometimes they yielded to false positives, and so that created a lot of uncertainty in publics as to what is their utility actually. So what we can learn from contact tracing as one of the core lessons for using AI is, well, its effectiveness depends not only on the technical capability, but adoption category and behavior depends on a whole list of socio-technical factors. Next slide, please. And that's actually, I'm not going to stop too much on chest scan diagnostics, and perhaps maybe let's focus on this one for a moment, because this one is separate because of how it was used actually in the hospitals. And here we can see that by early 2020, more than 700 AI models were rapidly developed to try to diagnose COVID based on image analysis. That's really fast, and that's really a lot of technological innovation in a very short amount of time. But one of the key lessons that we show in this report is that it's sometimes smart to resist this time urgency of adopting technological innovation that does not at the same time have robust validation processes, that does not have a good way to show that the data represents different societal populations in different cases. And it is also very important to ensure that technology is not given this role of technological fix for a complex societal problem, but rather a principle of human AI collaboration is adopted to reach the maximum efficiency and effectiveness of AI use. Next slide, please. For quarantine enforcement, AI was used in a smaller amount of cases compared to contact tracing and to image identification for COVID in chest scans, but it was used, for instance, as a combination of GPS for geofencing publics that were diagnosed with having COVID-19. And in some countries, like for instance in Ukraine and in Poland, they were used to identify people in quarantine locations by demanding them to produce a selfie that would then correlate a location of people based on where they're supposed to be quarantined with GPS and facial recognition technologies that AI was based on. And there again, it produced a whole lot of different civil liberties tensions similar to contact tracing, for instance, epidemiological containment versus civil liberties, and also how much was legal enforcement based there next to with law enforcement with national governments that was not always clearly communicated. And these technologies very often yielded false positives. And they produced a lot of false violation reports that resulted in monitoring teams coming to check on people in those places of enforced quarantine. So that didn't instill a lot of joy in people, let's say. Some of these cases have their unique lessons, but I would say that they share a lot of similarities for what we can learn about adopting or jumping to new technologies such as AI in cases of crisis and emergency. What we can see across all of these three typical cases is that crisis accelerates adoption, but sometimes it happens at the expense of scrutiny because urgency dictates that we take some action. And these cases were adopted with different effectiveness. And we can see that it is sometimes really important to pause and to see, do we have validation processes in place? Can we check on our data? One of the most important lessons is that governance strategies have to be in place, of course, ideally before the emergency strikes, because then we have a lot of different ad hoc measures and ad hoc strategies that in the end translate to different type of effectiveness of this technology. And one of the other things that we also explore in the report is the environmental impact of using AI. And that is something that remains very unmonitored and underreported, and that's something that should be paid attention to. Thank you.
So thank you, Olya. And now we turn to Quentin, who is a head of innovation at the French Firefighting Service. Quentin.
Thank you very much. Yes, right now I am Commandant Bro. I'm not the captain. And as you said, I'm in charge of innovation for the French National Academy. And we have created the first AI lab for civil protection in France. So today we are leading 2 projects. One is a civil protection chatbot dedicated for scientific and training topics in civil protection. And the other one is dedicated to wildfires early detection. So we also have a mission, which is to make a photography for the French direction of all the projects in AI in civil protection today in France. So I will give you a few points of my my point of view, which is the point of view of a practitioner. I am not a teacher, not a professor, so it's practical question. So the first one is that when we speak about AI, we have to be very precise because some people speak about natural language chatbot, generative AI, but we also have expert chatbot, which is different. We also have different technologies such as computer vision. So the first point is it's necessary to be very precise when speaking about AI. What do you speak about? And the second one is the difference between ethical and judicial issues, legal issues, which is very important because a lot of people come to us speaking about legal issues, but it's very different from ethical issues, and in my opinion, it's very important. The second point is that my experience today is that according to the different technologies we have different results. For example, for early wildfire detection, it's efficient. For predictivity of operation on a given area, it's efficient. But we also have technologies that are not efficient, such as operational chatbot. So my third point is that some of these technologies seem to be very useful and helpful for practitioners. As I said, for example, early wildfire detection or predictivity of operations or planification for logistical issues. But other technologies are quite useless or even dangerous. I'm speaking about, for example, operational chatbot. An operational chatbot is a bot that give you advices and guidelines when you are on operation. We can say that because in France today you have about 10 or 15 projects of AI chatbot dedicated to civil protection. And at this point, we saw that answers are not, we cannot rely on the answer at 100%. And we have a lot of different problems, ergonomic problem, probability problem, ethical problem, etc., etc. So we have to discriminate between the different technologies. Some seem to be very useless, and other one are very helpful. My first point is that when you are on operation, we know that what is very important is emotion, is empathy with human, and the capability to give us courage, which is not possible for the machine. So this is a question: how do we deal with AI, considering that to solve a crisis, you need to be in emotion, in empathy, and giving courage to human. And then, yeah, my last point will be to say that the question is also, we see that the human spirit is working differently with analogy, with inductive, with deductive methods. So the different AI solution in civil protection, they put some question about how we deal with the operation, and for us it's very interesting. So I will conclude with to say that we are very interested in working with other universities to understand the interaction between human and machines and operation. And if you are also interested to work with us, we are practitioners. I can put my email in the chat or my contact if you are interested. Thank you very much.
Thank you, Quentin. And lastly, over to Remy, 5 minutes, which will give us 10 minutes for Q&A. Thank you.
Thanks a lot, and I'm delighted to be with you this afternoon in this broader European-wide audience, and even beyond the EU. I hope you can see my slide. I'm speaking on behalf of the group of chief scientific advisors. We belong to the scientific advice mechanism and provide independent scientific evidence and policy recommendations, and are very happy lucky to rely on the evidence reports from the working groups gathered by SAPEA. This issue of crisis is a very important one, as pointed by Jean Monnet, one of the fathers of the European Union, claimed that the Europe would be the sum of the solutions we came up with to seize crisis. So a few framing remarks, some have been already done, but I would like to insist on the fact that the crises share common features like high uncertainty, limited or unreliable information, time pressure, demand for high levels of legitimacy, cascading failures. We also remind, of course, that crises do not always only correspond to the acute phase, but that it's essential to consider also the post-crisis evaluation to gather valuable evidence, and to consider preparedness and even beyond prevention and risk reduction. The best way to manage crises is to be able to anticipate them. This has been clearly stated in a 2022 SAM report, which we believe is still very valid. This requires strong investment in infrastructure, surveys, monitoring systems, institutions, harmonized and coordinated across member states. Now, if we come to our key messages, we insist on the fact that currently using AI tools in the context of crisis in the EU raises huge ethical and sovereignty issues. there would really be a need for sovereign AI tools, since managing crisis implies to handle very sensitive individual data, information on important infrastructures. It's essential that this information does not circulate outside the EU, and in particular in rogue states. Hence the need for sovereign AI tools. The report identified several risks and opportunities. We would need a more formal technical assessment of all these risks and opportunities. And by that, we mean what economists call assessment of the opportunity costs. That is, also carefully assessing what we would lose if we switch to a strong reliance on AI in crisis management. For example, is there a risk of a decreased human expertise? Is there a risk of overemphasis on data analysis rather than data collection? This is possible because, as I've mentioned, crises are characterized by poor data quality, and the statistical saying that says that garbage in equals garbage out, we believe is very valid, meaning it's hard to make reliable inference on the basis of poor data, whether you use classical approaches or AI tools. And finally, we also insist on the guardrail that's present in the SAPEA working group report, distinguishing evaluation and decision. We believe that AI tools should not be used for any decision. The report says not to be used for morally engaging decisions. We believe it's hard to a priori know what is a morally engaging decision. Is closing a school a morally engaging decision? We don't know. The safe option is not to use AI tools currently for any decision, and to keep humans at the center of decision making. If you want to read more, please go and have a look at our statement available on the SAM webpage. Thanks for your attention.
Excellent. Thank you, Remy. And so let's move to questions. We've got 3 in the Q&A. I'm going to start with René von Schomburg, who is asking about anticipatory AI. And his view is that European governments were not very good at anticipating the coming COVID crisis at the beginning of 2020. Could AI have made a difference to that? And I suppose I will add to that, could AI make a difference when we have the next pandemic? So who'd like to have a look at that? Maybe Olya, starting with you.
Thank you. And thank you, René, for the question. I think it's a very important question because it shows that trust is not a single and monolithic property, but a multidimensional practice that is not just technological or social or governmental, but this socio-technical property. And it's something that we really clearly saw in the case of COVID-19 and all these different applications that I helped to review. So I agree with the, with the premises of your question. And as regard to, what would be the ultimate, so I don't think any one single of these different components of trust will be the final solution, be it AI or governance. What I see, what I observe, it's what happens in the interaction. The technology has to be trustworthy and to keep showing that it's effective and that it is credibly effective, that it doesn't have high error rates, as we saw in the case of, for instance, quarantine enforcement. That there's also robust and comprehensive governmental support and endorsement of this technology, namely clear communication that is also consistent. This is what hindered the adoption of COVID-19 tracing apps, particularly here where I'm based in the Netherlands, because the technology was actually technically ready and quite effective in its own, but it wasn't really adopted because the governmental schemes were not set up early in advance, and the required governmental adoption didn't come in time. And so by the time it came, it was almost the end of the pandemic, and people really had a strong mistrust of this technology. So what I see from this is this combination of social, technological, and institutional factors that have to translate to the joint trust as practice. So that's my long answer.
Remy?
If I can add a very short point, I would be tempted to believe that indeed COVID crisis is the illustration of what I've mentioned regarding the need for good data quality, what I don't think AI is essential to compensate. If you are talking about a crisis starting in a rather closed country like China, then whatever tools you may have do not allow you to make relevant modeling of an epidemics. So clearly there's a need to do more assessment of this past crisis to really identify what are the need for EU to more efficiently manage crisis. But certainly I would really support developing more infrastructure, more coordination, stronger institutions, stronger surveys, ongoing outside the context of acute crisis, and then analyze them with the most relevant tools, which may, in some cases, or not include AI.
And Tina, can I put you on the spot?
Yeah, thank you. I was between raising and not raising my hand because I'm also watching the time. I think I just completely agree with the previous speaker. So I'm trying to disentangle also in my head the trust in AI and the willingness of the government to act, and maybe also the trust of the public. Because what we've seen, and that's now independent of any data gap in COVID, that what I think Olja called adaptation actions of the governments were consistently late in different contexts, when we always could, even with the tracing, we always saw the onset of the curves. And then it was almost as if some governments waited until there was enough pressure on the health systems before they acted. And I think generally that's more of almost a trust in predictive modeling, trust in science, trust in forecasting, not a trust in AI or trust in data problem, because we could always see it, sort of the exponential curve starting somewhere with a delay, and we knew it was too late, and we see that in many cases. So I don't think that's a specific AI issue.
Thank you. And a question from Claire. Is the question about trusting AI, or is it about trusting the people who are behind the creation of AI? Maybe throw that one at Andre. Do you have a comment on that?
Yes, thank you. I think the problem has already or the answer to that question has already in parts been outlined. We know from intelligence studies that the failures most often don't occur at the intelligence level, so at the results, but at the decision making. We saw that with the genocide in Rwanda, which was known for a very long time that it would happen. But there was no action, and we saw it in other crises just as well. So the trust question is here crucial, and the question then, of course, goes further, namely, do we also trust those that have trained and provided the AI models that provide us with the decision-making support? And I think that just compounds on top of that the question of trust. Indeed. So not only is then the question of whether we trust the models, a lot of which are indeed still considered black boxes and hard to disentangle, but at the same time also the organizations that provide the training capabilities for these large models, which usually we find in the corporate sector, and a lot of that outside the European Union, specifically in the US and now to some degree in China.
Thank you. Anyone else want to comment?
Maybe just a small side note that I think, especially with some of the large language models, and as we are moving AI, I'm not sure how and in how far the developers can predict what the models will do. And that makes all questions on accountability or trusting these developers hard, because you don't have that direct link from the intention and the design to what the AI is doing.
And maybe I can add to that, and what Tina just mentioned is also particularly crucial with regard to liability questions. From a legal perspective, at some point, somebody needs to take a decision. That's why also the human in the loop is so important. And in the end, somebody needs to take also responsibility, whether that's political or legal responsibility for a decision in a crisis scenario. And I would argue that a lot of those that develop AI tools will shy away from taking responsibility for the results and the decisions taken by others with that tool. So the human in the loop, the human-centered focus of AI, I think, is without question.
A question for Quentin. What would it take for you to trust the operational chatbot?
In my opinion, the operational chatbot is highly dangerous for firefighters for different reasons. The first one is very practical, is that when you are on operation, you don't have the ergonomy to take something to write on the screen. The second one is a legal issue, because if you want to have a chatbot which is efficient, you need to feed to feed the chatbot with private data and sensitive data, which is, in my opinion, dangerous. The third reason is that as a decision maker, I tend to trust the machine more than my intelligence. And it could be dangerous because sometimes you are right, but when you trust the machine, you tend to change the way you are thinking. And the fourth reason is that the operations is a lot a question of relation with people and how you can motivate them and give them the right direction. And if you put AI chatbot between you and human, I think it's not efficient. So in my opinion, the operational chatbot is not very efficient, and I'm not the only one to think in that way. I have read the article from American US Army and to say the same thing for officers. It's not useful. Sorry.
Thank you. And we've got time for one more question. So we'll ask about accountability, which is a question that's come in. Have accountability issues been resolved? Where does accountability sit? So if we start with Andre on that.
Yeah. To some degree, the AI Act does help us indeed to address certain accountability aspects, specifically responsibilities when deploying, say, high-risk AI. For example, here we find the obligation to do a specific risk management on these systems throughout the life cycle, as well as the technical documentation that is required. So we find that some of the accountability questions have been answered, specifically with regard to providers and deployers of AI systems. So there we have now some clarity within the EU. Again, as mentioned before, there are caveats when applying the AI Act to artificial intelligence in crisis scenarios. Not all of them are high-risk AI. Some might be limited risk AI, and some might be simply falling out of the scope of the AI Act due to national security and military questions.
Thank you to everyone who's attended, the audience. Thank you especially to the speakers for an excellent webinar. The recording will be made available and we'll send you the link to the recording so you'll be able to catch up on this recording. And thank you again. All the best. Bye-bye.